I'm joined now in the studio by the immediate past president of the American Medical Association, Dr. Patrice Harris, and the commissioner for the Georgia Department of Behavioral Health and Developmental Disabilities, Judy Fitzgerald. Thank you both for being here. We're thrilled to have you today. Now, because we are in a pandemic, Commissioner Fitzgerald and Dr. Harris are more than 8 feet apart, and we were all socially distanced and masked until the taping of this segment began. Thank you very much. I want to go back to what we just saw, Cami Wolf-Rice. She's a mother who lost her son, and we know too many families in this situation. So let's dive right into this. We saw in the video that her son was never offered medication-assisted treatment, many times in treatment. Dr. Harris, why is there such stigma against this treatment?
You know, it was so hard to see that because we know what works. We know that medication-assisted treatment is evidence-based. The data is clear. Those who have an opioid use disorder do better than those who do not have access to medication-assisted treatment. You know, I think there's still a stigma. You know, there's a stigma associated with having a substance use disorder anyway, and such a stigma with medication-assisted treatment, even within the treatment and recovery community. And I believe what's driving that is inaccurate information and misinformation. So let's just start with the science, and we should make sure everyone has an equitable opportunity for MAT treatment.
Commissioner Fitzgerald, what do you consider Georgia's biggest challenge when it comes to this epidemic? And what are some of the things that are needed to move the state forward?
So I think there are a few challenges. You've heard over and over the issue of stigma. And it's such an important and fundamental challenge because if people don't, first and foremost, don't recognize that addiction is a disease, they're already going to be stigmatized. So accepting that addiction is a disease, accepting that it's an equal opportunity disease. It doesn't care what age, what race, or what your economic status is.
Right.
Addiction can be a part of any of our lives. So recognizing those fundamental truths is important. Once you accept those, then you can start to accept, just as Dr. Harris was saying, that treatment is available and treatment does work. And there are many paths to recovery. The most important thing is to break through that stigma and make it possible for an individual to say, I think I need help, and to reach out to others when they believe that they do.
Another question for you. How can the Addiction Alliance of Georgia best support the state's efforts?
So we were so pleased to see the Addiction Alliance of Georgia come together. Here's what's really great about what's happening in Georgia and why we're so proud. That really was led by private sector individuals, a leading academic institution, right alongside a national treatment provider organization who the state of Georgia already had ties with. And right from the beginning, they said, how do we make sure that underserved and uninsured individuals are a part of the conversation? And they invited our organization, DBHDD, to the table. And what we came to recognize right away is we're at our best when the public sector and the private sector are working together on behalf of Georgians in need.
And I know that we all agree education is a critical piece of this initiative. So can we talk about the importance of educating healthcare professionals in the state of Georgia regarding MAT? And this can be for both of you to talk about, too, the importance of that education.
Well, I'll start, and as you are aware, I have chaired the AMA's opioid task force since its inception, and one of our first recommendations was to encourage physicians to increase our education around MAT, around pain, appropriate pain care, and around opioid use disorder in particular. So education is key. You know, and physicians do that all the time, right? We get a continuing medical education credit, and so certainly we have the data to show that physicians wholeheartedly embraced continuing our education and becoming more educated on all three of those topic areas.
And I'd like to add, when DBHDD received the federal grant, the Federal Opioid Response Grant. This was an important area of investment, doing everything that we could to make it possible to make training available for physicians. But in addition, one of the things that we really tried to do was understand what are the barriers, not only to being trained, so you might be trained, but then why aren't physicians taking on more patients, right? As we see the addiction crisis really emerging throughout the state, really talking to physicians and trying to break down those barriers about what would make it more possible for you to open the door to see more patients. One of the things that we learned was that some of the physicians did not feel like they knew enough about the resources that were available in the community. So, because once you may go to treatment, be successful in treatment, but it's also you want to be able to link your patients and their family members to the other resources that are available. So we've made a really strong effort in the state to partner with the physician community and really understand what stands in the way, not just of the training, not just to understanding, but really advancing clinical care and then connecting to resources to lead a life of recovery even beyond treatment.
Dr. Harris, earlier in the program, we discussed how insurance companies drove people to opioids. Can you talk about other medicines that are effective for pain and the alternatives that exist?
That is a critical part of the conversation and really, I think, amplifies so many barriers, not only to treatment, but also to alternatives to pain care. Because as we talk about the opioid epidemic, it is so important to talk about it in the context of pain care. And we saw, through our research at the AMA, that, it is absolutely quite easy to say, please recommend an alternative to opioids for your pain care, but those alternatives are not always equitably available, such as physical therapy or biofeedback. And the other piece that we don't talk about enough is you really have to have access to affordable, meaningful health coverage to even think about physical therapy, affording physical therapy. And then you have to think about paid time off from work, transportation to the physical therapy center. So we really need to eliminate all barriers, but those barriers that payers put up, such as prior authorization and step therapy, have to be eliminated immediately.
Another question for you. As you said, you chair the AMA's National Opioid Task Force. What's happening at the national level that could impact and help us here in Georgia?
Well, again, to highlight the importance of a national framework to look at eliminating the barriers. Now, state insurance is regulated, or health insurance is regulated at the state level. And so we certainly have at the AMA called nationally on the state health insurance commissioners to look at any barriers to care. And a key area is parity. Parity has been on the books for over a decade. Federal parity laws. Some states even went further, but we've not gone back to see if our payers, our insurers, are following those parity laws. So those are just two of the many areas from a national level that we are looking at to make sure that these things are happening on a state level.
I'm wondering if one of the last things we can talk about, and Dr. Harris, I'll begin with you, is the racial disparity that exists in the opioid crisis. Can we talk about that a little bit?
We absolutely can, and I have highlighted this, and as currently we are now in the midst of this COVID-19 epidemic, which has brought into stark relief health inequities in our country that already existed. They existed around a lot of chronic disease. They existed around the opioid epidemic, and particularly in our response to the opioid epidemic. In the 80s, when most of the folks who were having trouble with this addiction, with opioid use disorder, and it was heroin, our country's response was incarceration. Now that we've seen an increase in a lot of the folks who are impacted are middle class and upper middle class white Americans, we see a change in our response to treatment. Now, as a psychiatrist, I am glad to see that change in response, but we have to appreciate our inadequate and unfair response before and make sure, actually it's even more important to make sure that everyone has access to medication-assisted treatment or other therapies for an opioid use disorder.
Yeah, if I could just add to that. You know, as I mentioned earlier, you know, addiction as a disease is sadly an equal opportunity disease and pays no mind to your age. As we saw in the video, so many families all around the state are impacted. And so in the same way we know that it can impact anyone, we're working hard to make sure access to treatment and all paths to recovery are available for people all throughout Georgia. And that's really the reason our department has prioritized. Our priority population are individuals who are uninsured, but making sure we're working in partnership with community providers to ensure that medication-assisted treatment, peer services, recovery, and all the other ways that people might take that first step are available all throughout the state. And we'll continue to do that.
And it's an important conversation that we clearly need to continue. Commissioner Fitzgerald, Dr. Harris, thank you so much for being with us today.
Thank you.
Jay, thanks for your interest.